Um, Today, I'll be giving an overview of global pediatric surgery challenges and opportunities, and I'll focus specifically on the evidence from Nigeria and the progress that has been made so far. Nigeria's healthcare system is organized into three levels. We have the primary healthcare centers with about over 28,000 centers. We have the district and general hospitals, and then about 55 tertiary hospitals, which are the main referral centers. The country has a population of over 200 million, and nearly half of these are made up of children less than 15 years of age. A significant amount of births in the country are not attended by skilled health personnel, with personnel attending to just about 47% of births that take place within the country. Infant mortality rate is about 72 per thousand live births, neonatal mortality rate about 36 per thousand live births, and under 5 mortality about 105 per thousand live births. These figures are actually quite high and very dismal. Looking at the burden of diseases or surgical diseases in children within the country, the actual incidence of congenital anomalies is not known, but from hospital-based studies, there are reports that the incidence is about 2.2 per thousand live births in the eastern part of the country, and as high as 111 per thousand live births in the northern part of the country. This may not be unrelated to the high occurrence of consanguineous marriages that take place in the northern part of the country. From hospital-based studies, it was found that about 50% of pediatric injuries occur following road traffic accidents. However, falls are more common from community-based studies, with non-accidental injuries accounting for about 21.3% of all cases of trauma in children. When we did a countrywide study that involved 17 tertiary hospitals and about 304 units, it was discovered that more than 60% of patients had to travel more than 50 kilometers to access pediatric surgical care, with an overall 30-day mortality of up to 58.3%. The cause of mortality included severe surgical site infections, lack of nutritional support, and apnea. Analyzing the workforce situation within the country, currently there's just about 127 pediatric surgeons, to attend to nearly 100 million children, and the density of pediatric surgeons is about 0.16 per 100,000 children less than 15 years of age. This is as opposed to the 1 per 100,000 children less than 18 years of age recommended by APSA. And pediatric anesthetists, we have just 5 of them in the country. Looking at access to pediatric surgical care, it was discovered that a high percentage of patients have to travel more than 120 minutes not to access a facility with the pediatric surgeon in attendance. When we worked on the surgical plan for Nigeria, it was also discovered that most of the pediatric surgeons and anesthesiologists were concentrated within the urban centers, and especially in the southern part of the country, which large swaths of the country being left without ready access to pediatric surgical and anesthesia care. Like I mentioned earlier, most births happen at home or at traditional birthing centers supervised by traditional birth attendants or family members. The implication of this is that children that have congenital anomalies usually present ill, in critically ill states, with little or no resuscitation at primary referring hospitals and very limited nutritional support. There are very limited children-specific operating room equipment and space, and with the country having no specific children's hospital that attends to surgical conditions, and there's limited neonatal intensive care unit facilities with no functioning NICU in any of the 55 tertiary hospitals currently existing. Transmission of ill neonates is also done in a very unsafe manner, with parents most of the time having to transport the children who are with a surgical illness in whatever means they can afford. Financing of care for these children is also another very important aspect to look at. And it's interesting to note that although public health insurance exists, it is very limited in nature and covers only just about 5% of the population. And most of these 5% are oftentimes those who are in the formal employment sector. What exists within this insurance often does not cover surgery and completely excludes congenital anomalies. Private health insurance exists, but it's out of reach for most of the families. And ultimately, about 95% of families have to pay out of pocket to access surgical care. Putting this against the backdrop that majority of people within the country live on less than $2 a day, the implication is that a lot of people actually incur catastrophic and approaching expenditure from seeking pediatric surgical care. From a study that we did that looked at surgical treatment of typhoid intestinal perforation in children, it was discovered that from cost of surgery alone, all the parents went into catastrophic expenditure. How much has public health incorporated surgery in Nigeria? When we looked at the current National Strategic Health Development Plan, it was discovered that there was no prioritization of inclusion of surgical care. When we looked at the section that dealt with the state of child and adolescent healthcare, there was practically no emphasis on surgery, despite the fact that surgical care is it's very important and critical for in children. Despite all of this, some progress has been made. Currently, there is an Association of Pediatricians of Nigeria, which regularly organizes revision courses for surgical residents. There is the book that has been published that involved quite a number of authors from low-income countries and high-income countries, and it specifically looks at it takes into consideration the limitations that exist within the low-income countries when managing pediatric surgical conditions. There is also the Pan-African Pediatric Surgery e-learning platform, which is a ready resource for training and learning for pediatric surgery residents. Then there is also ongoing South-South training collaboration, between countries, with training rotations occurring between Nigeria and Ghana and Nigeria and Cote d'Ivoire. Over the years, there's been an increased number of pediatric surgeons, with just 35 in 2003 and to the current number of around 27 in 2022. One of the things that has happened in Nigeria is the specific inclusion of children's surgery in the National Surgical Obstetrics Anesthesia and Nursing Plan. This has provided a ready platform for increasing advocacy for children's surgery in the country. And this was done using the optimal resources for children surgical care, which was developed by the Global Initiative for Children's Surgery. And this resource gave a ready structure and platform for including children's surgery within the National Surgical Plan. The impact of inclusion has been felt in the area of infrastructure, in the area of life support, and nursing care for children. SmileTrain has been intricately involved in implementing the plan, and they have supported the creation of children's specific operating rooms in 3 institutions for now, and more are still on the way. Supported training of healthcare personnel in basic life support and pediatric advanced life support specific for children. And they've also carried out a nursing care saves life training for nurses that caring for children with surgical conditions. Also, currently there is the development of an Africa-wide surgical plan, and children's surgery has also been specifically included in that plan, so that even across the continent there will be a strengthening of children's surgical care. There are ongoing international collaborations aimed at strengthening children's surgical care. Recently was a workshop at the Geneva Health Forum, and the overall goal of the workshop was to come up with ideas and innovative solutions for strengthening, especially neonatal surgical care within the continent. And The uniqueness of this is that it had a multi-sectoral approach with stakeholders from the private sector and the public sector, and from development partners being involved in developing this project and implementing the project to strengthen neonatal surgical care within the continent, using Nigeria as a case study. There are also other international collaborations, such as the Global Initiative for Children's Surgery, which is a consortium of children's surgery providers seeking to strengthen children's surgical care within low-income countries. And then there is also the project Surgery in the First 8,000 Days of Life, which is really a platform for advocating for increased investment and strengthening of children surgery in LMICs. Other opportunities that exist include training collaborations. There is the pediatric anesthesia training that is being developed and will start shortly. It's a collaboration between Vanderbilt, Harvard, and the West African College of Surgeons. There more investment and training is still being required in the area of pediatric critical care. And then research collaborations are also ongoing and need to be strengthened. Existing problems include, for us in Nigeria, include lack of a children's hospital. And this still implies that children have to struggle with investments and infrastructure that are most of the time targeted at adults within the general hospitals. There's also a high rate of out-migration of personnel, which continues to diminish the available workforce within the country. So in conclusion, this is just pediatric surgical dashboard for Nigeria, and we can see the workforce density, showing the extreme inequities in access, with population density of just about 0.13 per 100,000 children less than 15 years of age, anesthetist density, pediatric anesthetist density of 0.01 per 100,000 children, and a nursing density of 2.4 per 100,000. We have just 55 tertiary hospitals, with only 4 hospitals having fully equipped children's operating room within the country, and no functioning public children's hospital for a population of nearly 100 million children. Thank you very much.